And then we have a kind of a fourth crisis, which is that people are not being given all the information that they need to survive and to take care of their own health. Because we hear that the medical establishment, hospitals, will be overwhelmed, and there are many things, which we can talk about right now if you'd like, that people can do to look out for their own health if they cannot access a hospital. I have a lot of faith in Nigeria. I've seen the movie 93 Days because Nigerians have seen this movie before. Everything that Nigerians learned, and especially people in Lagos, in dealing with Ebola, about washing your hands, not touching your face, not going near people who are infected, you have an advantage. You have a psychological immunity because you've seen it happen before, you've gone through the panic, you've gone through this feeling of terror, which itself can put someone in the hospital, and you've come through on the other side. So I think that the way that Nigeria handled your cases of Ebola in 2014, just remember the lessons, remember what you did then, because you solved that problem. The United States has not had this problem for 100 years, so while everybody in Nigeria who's an adult knows what to do, almost nobody in America knows what to do. The single biggest thing that people are not doing, that they need to do, is to wear a mask. And people do it all the time. Japan and Korea, Singapore, Taiwan, those societies have a much lower rate of infection. And I would just add to that, that I would say that people should be doing stinky masks. So this is a paper towel, and on it I have put clove oil and I've put thieves oil. So there are things that have antiviral properties that you can put between your breathing system and the mask, which can increase the effectiveness of it, at least in my opinion.